Alright, here's our video pre-lab for the Orbit lab for Monday, which would be the 24th. This lab is going to take us looking at the eye from 2 points of view, both from above and anterior. I think what probably makes the most sense to go through it logically would be to do the superior first. When in reality you're going to be doing both at the same time. You're going to be doing one on one side, you're going to do the superior approach on one side, and then in the other you're going to remove the eye and do the anterior approach. So this is what it will look like when you're done. But to sort of get us going here, we're going to start by working through the cranial vault. We're going to identify the roof of the orbit and the frontal bone. We're going to use a chisel and a hammer to break out the bone from the roof of the orbit so that we can see down into the orbit from above. So that obviously is not what we're not going to remove that much frontal bone, but we're going to want to remove quite a bit so that we can see this whole area and all of these structures in the orbit. Some of the things that should become immediately apparent, well, you won't see this right away. There's going to be a sac that surrounds all this called the periorbita, and that surrounds all of these structures and holds them all together. So you're going to have to open that sac up, and it also won't be quite this clean. There's going to be a tremendous amount of fat packed into that space. So you'll have a fair amount of small detail picky work to do, but one of the things that you'll see right away is the frontal nerve, which was right underneath the frontal bone, and then the levator palpebrae superioris, the muscle that opens the eyelid. You'll see these two things straight away. The frontal nerve you can follow out distally to see its two branches, supraorbital and supratrochlear, kind of following the drawing that we did in class. And if we go to the medial side, we'll be able to find superior oblique. This is the muscle that has two parts. A part that runs up the medial side and then hooks around a trochlea, and then it comes back and then goes underneath the superior rectus and attaches on the posterior side of the eyeball. So this is the unusual superior oblique muscle. You may be able to find the trochlear nerve coming into the posterior part of the muscle. You won't get very far. It'll come in here, won't come in clear up here. So look for it at the posterior end. Next we'll be reflecting the levator palpebrae superioris. You could reflect it either from the anterior or from the posterior. Either way it works. And then you can see superior rectus. And then at the same time, about at the same level, you might want to look over to the left or the right if you're on the right side and identify the lateral rectus. The lacrimal gland might be a little tricky. It looks a bit like fat, so sometimes it's hard to differentiate it from the surrounding tissue. But if you've got lateral rectus identified and maybe a candidate for the lacrimal gland, you can definitely find the lacrimal nerve running parallel with the lateral rectus but superior to it. So if you looked at them from this point of view, it's definitely superior to the muscle. And that's different than the abducens nerve, which is down here innervating the muscle on its inner or medial surface. So don't make that mistake. Separate the abducens, the motor supply to the lateral rectus, from lacrimal, which is up superior to it, supplying that the gland. You may get lucky and you may see this communicating branch coming up and joining the lacrimal nerve, but it doesn't happen very often because this lacrimal nerve is pretty small and often damaged. Okay, if we reflect the superior rectus, again, front or back, doesn't really matter, that's going to give us access to a deeper space, be able to get a clean view of the optic nerve, and probably the biggest things we're going to look for down in here would be first the ophthalmic artery. There's lots and lots of branches. None of them we need to identify, just the big ophthalmic artery will do. But if you look on the medial side, there will be a superior oblique, as we saw before, and then inferior to that would be the medial rectus muscle. And that muscle sort of follows the same path, just a little bit more inferior. And if you look for a nerve, this nasociliary nerve has a very particular course. It crosses over the optic nerve and then goes from lateral to medial, and it actually passes in between the superior oblique, and the medial rectus. And then if you follow it out to its end, it has this trademark division where the anterior ethmoidal nerve branches off and goes into the nasal cavity, and the infratrochlear continues on to go out to the face. You probably won't be able to see this part of it, being as we're dissecting from above, but you'll definitely see this signature division of the nasociliary into these two parts. So that's pretty much what you're going to get from the superior approach. You might be able to see from the nasociliary, you might be able to see some branches that come off and go to the eye. Those would be either long or short. Generally, the short ciliaries are more lateral and are associated with the ciliary ganglion. So if there's a way to tell them apart, that's probably going to be it, the presence of a ciliary ganglion. But that pretty much is what we're going to see from this particular view. If we switch to the front, or the surgical approach, and now this can actually be happening at the same time. As soon as you're done chiseling out the roof of this orbit, you can be the other people on your team can be working on this orbit to start removing the eyelids to expose the eye. And I'll just show you on this side what the eye removal, how it works. Basically, you remove the eyelids, open the conjunctiva all the way around the eye so that you can get back into this space where the muscles are. And we're just going to try and hook each of these muscles with a probe and then cut them off with a scissor or a blade. Just each of these 4 rectus muscles one at a time. And then the eye will become much more mobile, and you'll be able to pull it forward. And then you can cut off the oblique muscles as you're pulling, both the superior and inferior oblique. And then ultimately what's going to be holding you back is this optic nerve back in here. And as you can tell, it's pretty packed in there, so you're not really going to be able to see it. You're just going to have to, get back there with your scissor and kind of feel it with the scissor and then cut right through it. And then that will allow you to pull the eye out completely. Once the eye is out, you're going to have a lot of fat removal work to do because it won't look anything like this. It'll just be full of fat. So start removing that fat with the goal of having clean bones with muscles that are laying flat with this sort of clock face orientation, so that you can think of this as like 12 o'clock, 3 o'clock, 6 o'clock, 9 o'clock. I find it really helpful because then I can put things like superior oblique here at 1:30, or maybe something like, like the lacrimal nerve. I can put that over at 10:30, and I can kind of think about it that way. It helps me out. From this view, you should also be able to see some things better than others. The inferior division of the oculomotor is very obvious. It's a large branch, and it's usually associated with the inferior rectus. The abducens nerve, maybe you'll see associated with lateral rectus. And then the nasociliary, again, you'll probably see from this view with that trademark branching, from lateral to medial over the optic nerve, and then with the branching to the anterior ethmoidal and the infratrochlear. So that is sort of what you can expect from the anterior approach. With the eye that you've removed, there's no structures to identify inside, but I'd encourage you to cut the eye and try to identify whether you have an artificial or a real lens, because many, if not most, of the eyes in the lab will have artificial lenses in them, so it'd be sort of interesting for you to see the difference. They look quite different from each other. To do that, you're just basically going to cut the eye circumferentially along its edge here and cut it into an anterior half and a posterior half. And then you'll be able to get in there and see the iris, the lens, and some of those structures from the inside. So that's our lab on the orbit. It goes quite quickly once you get the spaces exposed. So we will see you on Monday.